There it goes. All right. Welcome back to another edition of the Nectar Blueprint and Lessons with Legends. We're excited to have a legend on today as kind of a pioneer in some of the things that we use here at Integrated Practice. And I'm going to let Buzz, Dr. Korth, am I pronouncing that right? Korth?
Yeah,
Go
it's
through.
like north with a K, Korth.
All right, Korth. I was
Yeah,
on
we're
it.
close. We're close.
And I'll tell a little bit of my story how we got to it, but I really want to hear your story and just dive into the background, your background, what your journey that got you to where you're at today, where we've kind of met, and you've been helping us clinically as well. So go ahead, Buzz, jump in.
Yeah, I think our backgrounds are pretty similar. I'm a chiropractor by trade, um, and was doing the basically was pretty much a straight up chiropractor for the beginning of my career. And then I realized as a chiropractor we could treat lots of stuff, but there's some conditions that medical would definitely benefit.
Yep.
So I integrated with hired a medical doctor, and she's been with the same medical doctor the whole time, which is kind of cool. She's been with me for 15 plus years,
Wow.
and we integrated like a medical practice with a chiropractic practice, and kind of getting the best of both worlds. She understands how chiropractic works, I understand how medical works, and I would say not traditional medicine. When someone comes to our office, I'm not going to research what's the best way to mask what you got going on, but how can I get your body to heal itself? Kind of what you're doing, right?
You bet.
So and did that for a while, and then the whole the stem cell thing came about. This is about probably 8 years ago. And when I say stem cells, we're talking about umbilical cord extracts, the amniotic membrane extracts, and these were game changers at the time because the use of what we call those allografts, which are basically donated tissue from live healthy C sections to help different things like wounds heal and joints heal, was a game changer for our practice. Because really, when someone presented before with a chronic injury in a joint, there really wasn't much medical solution for those type of things. Cortisone makes it worse. Lidocaine doesn't do anything. All these pain medications make it worse, if anything. So the ability to add in some of the birth tissue stuff was a game changer for our practice. And I kind of guinea pig with my practice first. So when it works really good, then I kind of share with others. So
Love it.
we did that for a little while, and then we came upon we were using platelet-rich plasma also,
Mm-hmm.
and I didn't know much about platelet-rich plasma back at the time, so I thought it was all the same. And at the time, I was using a kit that now I wouldn't use on my dog, but I just didn't know any better, and kind of
Yeah.
figured out there's a huge difference in platelet-rich plasma. And then we also came upon this other molecule I think we're going to talk about today, which is alpha-2 macroglobulin,
Yes.
which anybody that has arthritis, the crazy thing here, anyone that has arthritis, you can stop and actually reverse the arthritic process. And before the discovery of this A2M molecule, that wasn't an option. So even if we were using stem cells, PRP, we could slow the progression down, but you couldn't reverse arthritis. So what that means for somebody is kind of like if you have a cavity, once you get a cavity, that sooner or later you have to replace the tooth or get the root canal or whatever. Arthritis works the same way. Once someone got the arthritic process, you could slow it down, but you couldn't stop and reverse it. And with this A2M molecule, which we're going to talk about today, that actually allows us as practitioners to take an individual who has osteoarthritis or degenerative joint disease, stop that arthritic process at the molecular level, and actually reverse it so that person doesn't have to have joint replacement surgery or surgery downstream. So, and that technology is here today. So it's kind of crazy. Um, and that's how I think we met. I know at your office, you're always trying to stay up on cutting edge stuff. I think
Yes.
I don't know how we got introduced, but I had conversations about A2M, and I think you've had really good success with it too. So I think that we want to get the word out to telling people that if you're listening to this podcast and you have arthritis, I don't care if it's in your knee, your back, your neck, wherever it's at, if you don't do A2M, eventually that joint will be gone. And it might be a year, it might be 5 years, it might be 10 years, but arthritis is a progressive degenerative condition. It's kind of like if you have a cavity. If you have a cavity and don't get that cavity fixed, no matter how many times a day you brush your teeth, eventually you're going to have to get the tooth pulled or a root canal.
Yes.
A2M allows it to reverse that. So,
Which it, yeah, and
um,
that's
so people
that's
probably asking, well, what is this A2M? What is alpha 2 macroglobulin? That's the $1 million question.
yes.
So A2M is considered autologous, which basically means we're making it from the person's own blood, which is kind of cool. And basically what happens, I think to really understand how A2M works, you have to understand what is osteoarthritis or degenerative joint disease. Okay. And what happens, anybody that has arthritis, no matter what joint it's in, it's always caused by the same thing. Your body releases these proteins called proteases, and that's the cause of arthritis.
Yes.
Now, to be clear, these proteases are released for a good reason. Either overuse, trauma, post-surgery, whenever you have any type of trauma to a joint, your body releases these proteins in the joint to work as like little cleanup guys, right? Like little Pac-Men. So they go in there and they clean up the tissue pieces and clean up, wherever something's being over, they clean up the damage in that area. So it serves a really good purpose. That your body's perfect. It does everything for a reason, right? There's nothing by chance. The only problem is once you get past between 35 years of age, those proteases are very large proteins that your body is releasing, and they get trapped in the joints. They can't get out. So think of that. Your body releases these little cleaner guys or little Pac-Men into there to clean up the little tissue pieces or clean up whatever happens after an injury. But once they're done doing their work and they can't get out of the joint once you get older, they start to eat away at the joint.
So they
So
don't
the
know to stop.
proteases are the cause of osteoarthritis. Yeah, it just doesn't stop. Now, but that's why younger people don't get arthritis. Because if it happens to your teenager or someone in their 20s, the proteases get released, they clean up the damage in the joint, and the proteases can actually get out of the joint, because when you're younger, your joints are more vascular and they don't get trapped in there. So when we get older, that's what happens, and they get stuck in the joint, and that's what basically causes the breakdown.
God, that makes
So
so
then,
much
as a
sense.
provider, you have to say, so let's say, or you say a provider or a patient, you're listening to this. So you go to your doctor, your knee hurts, they take an x-ray, MRI, whatever they do. Hey, you have arthritis. You have to make a choice. Here's the one thing we know for sure. If you don't do anything, for sure those proteases will eventually eat the joint to the point where you're going to have to replace the joint. That's a sure thing. The proteases don't stop. Proteases don't go away. The proteases aren't going to disappear if you're past about 35 years of age. So if you have arthritis past 35 years of age and you don't do anything about it, it's going to get worse with time. With traditional medicine, usually what they'll do is they'll say, hey, take some, ibuprofen or NSAIDs or something like that would be a first thing. But the problem with those NSAIDs is they work on this thing called the COX-2 pathway. And although they might be good at helping eliminate or masking the pain, those COX-2 pathway medications inhibit cartilage growth. So think about this. So you have osteoarthritis, you take a medication to mask it, and the pain's really a good thing if you think about it, Doc. The pain tells you what you should be doing. It's kind of like a check engine light on your car. So if my car's low on oil, I want the check engine light to come on to say, hey, don't go driving fast. Let's get it fixed. When you take a pain medication, it's like putting duct tape over the check engine light and saying, I'll worry about it later. Of course, that's worse. And then with these NSAIDs on top of it, they inhibit cartilage growth. So the cartilage that's already getting eaten by the proteases isn't going to be growing back at all, so it accelerates the arthritic process. If you want to go one thing worse than that, and this is the craziness. So you take the NSAIDs, the NSAIDs may help for a little bit, but obviously it's not fixing anything. So when the NSAIDs quit working, you go back to the doctor, hey, my knee still hurts. And they'll say, okay, great, we're going to do a cortisone injection or a steroid injection. So a steroid injection or a cortisone injection is like taking NSAIDs for a year or two straight in one injection. Causes ton of tissue damage in there. That's why you're only allowed to get 3 injections per joint per year. Because if a doctor would give you 4, it'd be medical malpractice because of the amount of damage the cortisone shot causes. So although it can help mask the pain, it really speeds up the degenerative process. So if you're getting cortisone injections in your past 35 years of age for joint pain, you're adding gas to a fire. You're making the situation way worse. And although you might feel better for, a week to a month or even a couple months, it will always come back with a vengeance, worse, because of the damage you caused. So if you really look at it, with traditional medicine, and not knocking on traditional medicine, by the way, Doc, but with arthritis, traditional medicine really just routes you to joint replacement or surgery if you follow that pathway.
It does.
Okay.
And
So
and I was just going to say too, and I'm very clear on this on the podcast and all my teachings and things like that. And Frank Schallenberger, in his book, I was just going back through this, and I just want to mention this, kind of tell everybody where we're coming through, by the ozone therapies and things like that, which we use prolozone. We've done things like that, and that's Frank's kind of brainchild. But and one of the statements that he made in his book was, he says, and this is why I love talking to chiropractors too, because this is our philosophy. And although Frank's a medical doctor, he goes, why are we not questioning the treatments that have high risk and high damage, i.e. NSAIDs and cortisone, but and not questioning those things as the detrimental effects, but we're more than willing to question and put aside some of the things that really work, like what you're talking about with this A2M that literally stops the degenerative process. So as we pick on medicine, I've gotten to this point in my career that, yeah, we need to pick on medicine. It's okay, because
Yeah,
and good
it's a
doctors, there's
rabbit hole
good,
you can go down.
yes, for sure. And there's good
I don't
medical
blame the doctors,
doctors.
Doc. I don't. Yes, but it's not the doctors; it's big pharma, right? Because
Correct.
you got to follow the money. So the doctors, the medical schools are run by big pharma now, and they're only trained on big pharma things. The cortisone shots, the NSAIDs, whatever the newest anti-inflammatory is. Because usually the newest one pays the most money. They make the most money until the patent runs up, right? So it's always the new one,
Yeah.
the new one. And I truly believe everything we need to heal is available to us in our own bodies or through nutrition. The answer is never drugs. And even like you said, ozone. Ozone's completely safe. The worst case scenario is ozone doesn't work.
Yeah.
It's not going to cause damage. Worst case scenario, it just doesn't help. But it always helps to some degree. Because
Absolutely.
basically, when you're using ozone, the analogy I like to use with patients is, so let's go back to what we'll talk about, our osteoarthritis. So you have osteoarthritis. We know we got to get the proteases out of the joint. So you do A2M, and we also know the body is always healing and regenerating, even your cartilage. And if a patient doubts that, just ask the, if you broke your leg, would your leg heal? Of course it would. Well, the cartilage in your knee or wherever you have arthritis should be doing the same thing. But obviously, it's breaking down quicker than it's growing back because of the proteases. So my job as a physician is to figure out what can I do to reverse that process to get the cartilage to grow back quicker than it's breaking down. Because our whole life is about, our bodies are always breaking down, but hopefully it's growing back quicker than it's breaking down, so we're alive. Because when you start breaking down quicker than you're rebuilding, you're dead,
Yes.
or you're on that degenerative process.
Yeah.
So in our offices, we really focus on what can we do to reverse that process, or at least slow it down. You might not be able to stop Father Time, but we know we can greatly slow it down. Okay. So, but basically the way you make A2M is very simple. The patient comes in and we make it out of their own blood, because this A2M molecule is actually produced by the liver. It's actually the largest circulating protein in your bloodstream, but it's so large it can't get into your joints. So what we have to do is take the patient's blood, filter out of the blood that A2M, basically it's a protein, and then concentrate that, and then we inject it into the joint. And it's a small gauge needle. It's like an acupuncture needle, so it's not like some big needle. It doesn't hurt like a cortisone shot. But when you put it into the joints, it binds and breaks down the proteases, literally stopping arthritis at the molecular level. And it works on everyone every single time that has any type of arthritis. It's that simple.
Incredible.
And then after that, once, it's kind of like the analogy, I tell patients that, we know if there's a garden and I go to Home Depot and I buy tomato plant seeds or something, if I put those seeds in good soil and there's light and there's sunshine, the seeds grow every single time. And your joint's growing every single time as long as you're fairly healthy. But if you get a beetle infestation, we'll say the proteases are like bugs and they're eating the garden quicker than the garden can grow, it's a problem. So as a good farmer, first thing I would do is I want to get rid of the beetles. So I'm going to do A2M first. But then if I want the garden to grow back, then I look at what other things can I do? Ozone, prolozone, platelet-rich plasma, some of the Wharton's jelly. There's lots of other tools we have in our toolbox to help it grow back. But step one is get rid of the cause.
That's incredible, and that's where really, when you and I had that first conversation over the phone, you mentioned that just directly. You said, Doc, you could flood this, you could fertilize it, you can do all these things with stem cells and platelets and things like that. But if you're not stopping the degenerative process, well, I was like, well, yeah. That makes sense. We're spending in the past, and we were just getting going, but there's another clinic that we were getting a lot of these joints, people attached to the joints and knee joints and hip joints that this other clinic was doing with just traditional PRP. And then, or they'd upsell them to a stem cell. And these people were frustrated because they're like, I spent $7,000 on stem cell and it didn't work. I didn't feel any pain relief. I don't know. And this just resonated with me because we were like, oh, this makes so much sense. You're not stopping the process. It is absolutely incredible.
Right. Yeah, and some people will get stem cells or PRP, and they'll get a little bit of benefit, and it'll buy them some time. But the people that have really bad arthritis, which basically they have a lot of those proteases in there, those are the ones that they'll come to your office and say, I've already done PRP. I've already done like a stem cell procedure. It just didn't work for me. Well, the reason it didn't work is there's so many proteases in there that, there's so many beetles in the garden. I don't care how much fertilizer you put in there, you can't outgrow the beetles. It's the same analogy. It's the same exact thing. So it's more logical. Let's get rid of the beetles first. And then depending on the individual, if they're healthy, sometimes that's all you need to do. But if there's a lot of damage and maybe they're diabetic or they smoke or, there's other, comorbidities, they're not healthy, let's put some fertilizer in there. And that's where, basically they're trusting our basically our practice of medicine. Is ozone the best thing? Is PRP the best thing? Is stem cells the best thing? And that's a case by case, because there's definitely, I mean, from being in practice, there's no cookie cutter in this whole thing, unfortunately. Like you got to look, each case is an individual case.
You bet.
So, but it's very logical to stop there. And the other thing I'll say with A2M, and I think you experience the same thing, you'll never do A2M on a patient with arthritis and have them come back and say they got no result. It works every single time on every single person.
That's the truth.
Because the other thing it does is when you put this protein into the joint, that not only breaks down the proteases, but it also breaks down these things called cytokines. And as I said before, the body is a miracle, right? The more you know how the body works, the more you realize there has to be some type of God or something, right? This is not by chance. But when you get injured, your body releases these cytokines, which cause pain, which, remember, pain's good. Pain's not bad. Pain's good. So if you injure something, pain's like, hey, don't, knucklehead, don't go running today. There's a lot of, we damaged the knee. Let's not go run today. So the worst thing you do is take a pain medication and go run. So, but those cytokines are what cause the pain. That A2M also binds with the cytokines, shutting off the pain. So it does two things. It gets rid of the cytokines, which gets rid of your pain, and more importantly, gets rid of the proteases, which are actually the cause of the arthritis.
Wow.
So, yeah, but it's powerful stuff. And, I can't, emphasize people strong enough. Like, don't wait. If you've been diagnosed with arthritis, and even if you've tried PRP or stem cell or something somewhere else, you have to go see if you're a good candidate for A2M. And really, the only people that wouldn't be a good candidate, and I hear this all the time. You probably hear too. Oh, I'm on bone. It's too late. I can't tell you people that said they're bone on bone. They come in, they're not bone on bone. Right? I don't. I want to see it myself.
Yeah.
I see it. And I hear that every week. If the joint is totally destroyed and gone, which I want to see it myself, then of course it's not going to grow back bone. Okay. If there's a hip joint that the ball's gone or something, that's not going to grow back. But you can have no cartilage, but the bone's in good shape, and that'll heal. And that's pretty far along the case. I would almost venture to say if you can walk into the office, there's a good chance we can help.
That's a good rule of thumb. Is a good rule of thumb. We had a case, and she's in her probably late 60, I want to say 67, 68 years old, and been through exactly what you just patterned. 3 different medical doctors, referred to surgeons, pain management, and it was her shoulder, and the shoulder took some damage in a car crash, and there's all these types of things. We get her MRIs, results in, looked at it, or she said she had an MRI, never did. We ended up deciding to get an MRI, see what soft tissue might have been damaged, and all these types of things. She's got severe degenerative changes in that shoulder joint, from the AC joint to the ball and socket joint. Anyways, long story short, our medical, we call him the Nectar is a name of our business. We call him the Nectar Injector. So he's he gets in there and hardly can get this needle in. It's just because of the degenerative change, but it wasn't at that surgical point yet. And literally within 2 days, we had a follow up with her. She's like, "This is the first time I've been pain free in the last like 15 years." She's like, "I've been dealing with this."
Amazing. Yeah, and just to be clear, she wasn't healed all the way yet, but basically you removed the proteases, so you stopped the arthritic process and you got rid of the cytokines, so now she's able to sleep and wasn't in pain. And you can't overemphasize the importance of just being able out of pain and being able to sleep, right?
Big
You know, if
time.
you're in chronic pain all the time, and what people have to realize too is when you have pain, when you have those cytokines that cause pain, think how amazing this is. That tells your body, hey, there's damage here, so your body releases more of the proteases to eat up more of the. So arthritis accelerates with time because if you have pain, your body releases proteases to clean up damage. But remember, those proteases are the same thing that eat the joint. So you
Yes.
really got to handle both. You got to get rid of the cytokines so you don't produce more proteases, and you got to get the proteases out of the joint if you want to stop this whole degenerative process.
So that's the immune
So
systems at work, correct? And those cytokines are kind of signaling for more of the proteases to come in, if I understand it. But you had mentioned
they're
that
signaling you not to use the joint. Yeah.
Go ahead. You were saying.
Yeah, two purposes, like you said. So number one is it's telling you, hey, you have pain. Don't overuse whatever, whether it's your back, your shoulder, your knee, your hip. Let's not overuse it because there's an injury here. And then your body's like, hey, there's an injury here. We need to put those proteases in there to clean up the damage to hopefully try to, clean out all the debris in there. So there's two different processes going on. But those two different processes are destroying the joint. So, and the sooner you treat these things, the better. You don't want to wait until the joint's totally chewed up. And as I said, so, a kind of a rule of thumb, if you can walk into the office, there's a good chance we can help. I can't promise everyone that, but like, don't go by what your doctor said because if your doctor said it's too late, you're gonna have to replace the joint. That's if you follow traditional medicine. So if you're just
Right.
going to do cortisone and take anti-inflammatories or whatever, yes, you will have to replace the joint. That's a correct statement. Your doctor's not lying, but they're not factoring in what we can do with regenerative medicine. And there's a reason why, the NFL uses regenerative medicine. All these athletes, the UFC, all these high-paid athletes, they're all doing this stuff now, right? So this is not new, but it's new to the general public. And the reason they're doing it is, everyone knows an artificial joint's never as good as what God gave you.
Yeah.
So you always want to try to save what you have.
Absolutely. Yeah, surgery last for sure. And that triggers kind of back to our initial conversation, how we got there, but and I'll cover that too because that triggered with NFL, and I've never really actually asked you about it, but it's funny how the chain of phone numbers that got dropped to where I was able to get in touch with you. But the one thing I want to ask is on the A2M, if I understand it correct, and I really don't like to use this terminology because it kind of jumps into the steroid, because you get a lot of people, well, how long does this last? And I know the A2M will continue to release and continue to block proteases for a certain period of time. But I caution people. I said, look, we're not putting a medicine that's blocking this whole scenario. You're actually healing the body. So last is like a half life of a medicine compared to lasting when we're talking about changing this whole process and doing a full 180, and like you mentioned, just regenerating that cartilage and stopping that degenerative process, correct?
Correct, correct. Yeah, that's a great. So when people ask how long is this going to last, the answer is, it should last as long as you last because we're healing it, right? And
Yes.
you kind of like you said, there when you're dealing with drugs like cortisone or NSAIDs, those all have half life. So basically, what a half life is if you take it, and we'll say a half life is an hour. An hour later, it's half as strong, and another hour later, it's half as strong as that. Regenerative medicine works the opposite. Think of so when you think of regenerative medicine, I want you to think of a garden. So if you have a garden, let's go back to the garden analogy, and there's beetles that are eating the garden, so they're killing off the garden. If you get rid of the beetles in one day, are the plants gonna grow back in a day? The answer is no. It takes
Yeah.
time.
Yeah.
But we also know they grow back every single time as long as the body has what it needs. It's a sure thing, and it gets over time. So I tell people, with these regenerative medicine procedures, sometimes it takes up to a year to see the full result. right?
Absolutely.
So, but you're not going to be, when you get your cortisone shot, that the first half life is the strongest cortisone. The next day, you're going to feel the best, but it's going to wear out over time. So you're not fixing anything. With regenerative medicine, it's the opposite. You're going to get results, but we're dependent on the body to heal itself. But the beauty of
Hmm.
that is it lasts as long as you last, unless you mess it up again or something, obviously.
Yeah. No, that's such a good
It's funny
point.
you even asked that question. I had a patient text me last night. I could show you my phone. It was 11 o'clock at night. And he had a younger guy. I want to say like 35 years old, but he had real bad arthritis. They had actually gone in and done the procedure where they drill a bunch of holes to get the bone marrow out, and nothing worked. And we did A2M on him and a follow up with PRP. And it's kind of crazy about this conversation. He texted me last night. And he's like, dude, because his life was ruined. He's a personal trainer, and he played
Mhm.
college football. And he's like, man, I just thanking you again, which I thought was cool. But I'm paranoid the pain's going to come back. It's been a year now. How long is this going to last? And I said, brother, unless you mess it up again, you won't be seeing me anymore. Because it should last
Yeah.
as long as you last. Now, obviously, you get a car crash, you hurt your knee, something else, but this doesn't wear out unless you wear out.
I love it. I love it. Yeah,
So,
and that's it was interesting because our compound pharmacist had buggered up his shoulder, and so I asked him. We had a conversation around Christmas. It's probably over a year ago, and I said, "What did you do?" And he says, "Well, I definitely did some stem cell, but I did something beforehand. I don't really know what got done, but it literally my follow up MRI, the lesion in my supraspinatus, the rotator cuff was like gone. It was better." And he goes, something in the fact of this
that's
guy's
great.
now, yeah, he was like, this guy's he's now working with an NFL, like something with the Panthers and all these types of things. So I gave him a call, and I get another number, give this guy a call. And he says, you got to contact this guy. This guy says, hey, you got to call Buzz. You got to call Buzz. This is, and so it's funny how I got all the way up to you. And then as we had this conversation, we're now, leaning on you for stem cell and these A2M products and all sorts of cool stuff. And so tell me about that journey a little bit on with the stem cells, because you ran into what I actually saw, which was middlemen that were trying to do, almost a salesman in between, where they were harvesting to down to these sales units that were then filtering it down. And you kind of saw some issues with that, correct?
Yeah. Obviously, I became a little frustrated with the quality of some of the products, but I saw really good results with the Wharton's jelly extract stuff. And just to be clear, so when we're talking about stem cell, it's really we're talking about extracts from umbilical cords,
Yes.
and these are only from people that have healthy C-section births, and they donate the umbilical cord. So there's no aborted babies. We're not, I don't want anyone to think any of that. That's illegal in the U.S. So there's none of that. These are
Yeah.
females that consent when they have healthy C-section births to donate the umbilical cord and other birth tissues, and they use them for things like wound healing and lots of other things just to help people heal. So, the way I like to think of these or explain to patients, they're just like fertilizers. So when you're using a Wharton's jelly or even a platelet-rich plasma, which you make out of blood, you're just adding fertilizer to an area to help the body heal itself. Because once again, we don't fix anything; we just help the body heal itself. Okay.
Yes.
So, but basically with that, I worked at a lab and I saw that we had a good product, but we knew we could make it better. And I was lucky enough; I partnered up with the main scientist there, and this is 8 years ago at this point, and we started making our own product at that point, out of the umbilical cord. And as a fertilizer, once again, if you have arthritis, you got to do A2M first because you got to get rid of the cause. Because if you put fertilizer, you could put good fertilizer in there, you can outgrow the beetles for a while, but if you don't get rid of the beetles in the garden, the arthritis will come back, right? So do the A2M first, but then if you want to add, and the different fertilizers you have is birth tissue. That Ward's jelly works amazing. A good double spin platelet-rich plasma works really good, which is something you can make out of a person's blood. Ozone and prolozone work amazing too, and that and it really depends on how bad the person is, and that's a case by case. Sometimes we use ozone, sometimes we use Wharton's jelly, sometimes we use PRP. Sometimes if they're messed up, we have to do a couple combinations of those things. But at the end of the day, the body will heal. If you're alive, you can heal. So if you're listening to this and you have an injury that's not healing, you're just not doing the right stuff. Because if you're alive, you have the ability to heal.
Yes.
And don't get discouraged if you've done, you think you've tried everything or done everything. You haven't. Everybody can heal. I've had people in their 90s heal. I've had people that, like that person I just talked about who's 35, who had been to every doctor and they wanted to replace his knee at 35. Just because he had done every medical procedure and they told him he need to have a knee replacement, you got to get a second opinion.
Big time. Big time.
Very, very important.
Very important. And I think a lot of people are starting to shift out of that model of medicine and surgery as the only or the first steps versus exhausting all options and providing that environment for the body to heal. You had mentioned too, I'm just kind of jumping all over, but you kind of turned me on to, you turned me on to a different application of NAD as well. We were using NAD in IV format and injectables for longevity and mitochondrial health. And but as far as supporting mitochondrial, and supporting mitochondrial health around like degenerative processes like neuropathy and things like that, obviously this could have a big impact on the circulation of a joint and other vascular vascularization. Walk me through that, because you've been able to again shed a ton of light on me, where we're now including that with other like photobiomodulation with red light therapies and neurostimulators and things like that too. So
yeah, and all that stuff works. There's people ask what's the best therapy. Well, they all kind of work, right? Like,
sure.
Is laser better than red light? Is better than shockwave? No, they're all good, right? So that these are all good. And when we're talking about NAD, NAD is very important for cellular healing. And I think the easiest way to explain what NAD does is our body takes fats, carbohydrates, and proteins and puts them to this thing called the Krebs cycle to produce energy. And that's really why we're alive. Okay. NAD is the coenzyme that makes that whole process work. And if you're lacking NAD, your body, it slows your metabolism down. If you slow your metabolism down, it slows your healing down, and lots, energy, brain function, sleep patterns, everything's affected. So he was, what's NAD good for? I hate to say it, it kind of helps everything because it helps your cells function better, right? And I think what people feel is they heal better, they sleep better, they have more. It's almost like a stimulant, but you sleep better. And it gives you super mental clarity. And it's so important. NAD is one of the hallmarks of aging, because every 5 years from the time you're born, it decreases 20%. So think about that.
Yeah.
So that's why as you age, you heal slower. It's one of the factors in healing. That's why your energy goes down. That's why as you get older, you lose mental, sharpness and focus. So when you restore those NAD levels, it literally makes you feel young again. It's the craziest thing. And unless you experience it, you wouldn't believe it, right?
Yeah.
But I think you can tell from clinical experience, you'll never give somebody NAD properly and have them say it didn't work. Like, the results are profound. But the problem with NAD is it's really not available orally because it's broken down by the digestive juices in the stomach.
Yeah.
And it has such a strong effect. If you're doing it via IV, it's a 3 or 4 hour IV. And really, you want to do it 3 days in a row to start to get your levels up. So not a lot of people have 3 or 4 hours to sit in an IV chair to get this done. And then the final thing to consider is we're kind of going back to half-lives. The half-life of NAD is about an hour. So what that basically means is if you're doing 500 milligrams of NAD, after 1 hour, you're only getting the effect of 250 milligrams. And after another hour, you're only getting the effect of 125 milligrams. Wow. So that wears out really quickly. What we've done, and I think you're doing in your practice, is we can use a technology called iontophoresis, which is basically, I got one on here today. You can check it out. There's one there. I got mine on today. I knew I was going to be able to do it to be sharp. But basically what it does is there's a microprocessor in that, and it pushes through the skin the NAD. So think of it as an IV without a needle. You don't feel it. I'm not getting shocked or anything. But I'm getting slow drip NAD for the next 12 hours. So it literally feels like I'm drinking a pot of coffee, but I could go take a nap right now too. It's the craziest thing. But the mental clarity is through the roof. But it helps with healing processes, sleep patterns, all these things. And for people that are really deficient in NAD, which a lot of people are, helps with pain and lots of other things too. So the patch is the way to go. And I'm sure your patients love you, but they don't want to sit in your office for 3 or 4 hours a day, once a month or twice a month. They simply
Yep.
put the patch on, go through. I put mine on this morning. I went to the gym, worked out, got a shower. The patch can stay on in the shower. I'm going to wear it until I go to bed. So it's just amazing.
Yeah, and you're hitting on a
And once
component that
again, just helping the body heal itself.
yeah, and that's I did a podcast again specifically on how most natural or alternative, which should be mainstream, doctors are talking with patients about sleep and how important sleep is in the repair cycle and all those types of things. So you're hitting it on the head. That's if we're repairing and then allowing an environment to sleep, of course, cortisol can go down, inflammatory processes can go down, and then the body's got this phase of time to really reset things and allow that healing process to accentuate
Yeah, for
too.
sure.
So really, really important.
Yeah. And with those patches that you're giving out, there's 750 milligrams of NAD, but it also contains glutathione, which is the body's main antioxidant. And the same thing applies. Glutathione really not good orally, and the half life of glutathione is only about 10 minutes.
Wow, I
So
didn't know
unless
that.
you're doing injections every hour or so, or if you're popping pills, which you have to take a bunch of them because a lot of it is broken down, you have to be popping those pills all day long. You're not going to get a good pharmacological effect. But with the Ionto patch, I'm wearing it right now. I'm getting a 12-hour drip of glutathione all day today, which everybody needs glutathione because basically what that does is it prevents oxidative stress. And if you want to know what oxidative stress is, it's kind of like when if you ever make guacamole or bite an apple and let it sit around all day when it turns brown, that's oxidative stress. We all are exposed to that because of our environment. Glutathione prevents that. So everyone can benefit from glutathione.
Yeah, big time. It's one of my favorites to play with in IVs, but I'm going to put my patch on today too, just to match you. Um,
Yeah, you're slacking. You're
uh,
slacking over there.
I know. I didn't think about that for coming on the podcast. I should have done it. So, as always, on the forefront of things, and I appreciate you. And I want to let you talk anything more about A2M, but you laid a really good foundation for that. What are you seeing come down the pipe? I mean, biotech is going crazy. People are fractured with the medicine in a way of like the distress with COVID, and that's a whole different issue. So more and more people are just saying, hey, there's all of this stuff from peptides to like the A2Ms to all these more natural. And when I say natural, I mean this is all just isolated out of the blood and then put in areas that it can have the benefits. What are you seeing coming down the pipe? What are you interested in right now? Where do you see a lot of this in say 5 years?
I think our healthcare system is broken, um, and there's always a silver lining to everything. When I first started practicing, back in 2000 range, everyone had really good health insurance, $5 copay, no deductible. So if something wasn't covered by insurance, no one wanted to pay for it because everyone had really good insurance, and that's why you worked. And it'd be hard to sell cash things. Pretty much now, everyone's a cash patient because you're seeing $1,000, $2,000, $3,000 deductibles. And really, so our health insurance system now is really emergency care. You get a gunshot, car accident, it's the best in the world, and it'll handle that. But if you're dependent upon your health insurance and what's covered by your health insurance for your general health, you're not going to live a healthy life. There's no way.
Yeah.
So the good news is these cash procedures that actually work are going to continue to grow because people, if they're paying cash, it has to work. You're not going to pay. Why would you pay $200 for a cortisone shot that's going to make you worse when for a little bit more you can get a procedure that actually helps, right? So I think that the field of regenerative medicine is going to grow like crazy. Big pharma is always going to be in the background kicking and screaming because it's a turf war to some degree.
Yeah.
But I think people are getting smart and they realize, you really can't trust big pharma. I'm not knocking regular doctors, by the way, because like I said, if you have a heart attack, uh, gunshot, some type of something like that, we have the best doctors in the world. But you have to keep in mind your traditional medical doctor is not where you go to get healthy.
Yeah.
It's where you go when it's a crisis. And it's kind of like the same thing I always try to explain to patients when they say, does insurance cover it? And I'll say, well, all insurance works the same way. If you have car insurance, let me ask you a question. If you have car insurance and your tires are bald, does your car insurance buy you new tires?
I
Of
wish.
course not, because it's not catastrophic, so you got to maintain your car. You got to go buy tires on yourself. Now, if you crash your car into a tree because your tires are bald, then your insurance will cover it because it's catastrophic. Health, and so do you want to wait until it's catastrophic, until you have to replace the joint or until something worse happens, or do you want to handle it now? And the beauty is these cast procedures, everyone can afford them.
Yep.
We're talking, hundreds or thousands of dollars, not tens of thousands of dollars or whatever. These cast services are, everyone can afford them and they work.
Yeah, and the effective results on
So
them.
good things ahead for sure.
Yeah, I'm
Yeah.
excited. I'm
We just need to
excited.
spread the word and hopefully our patients too.
Absolutely, and I appreciate you jumping on and helping us do that. No doubt, this will impact different providers, medical providers, and integrated facilities. But it is tough. I mean, we had another chiropractor here locally was involved, and he came by to get some stuff, and I was telling him about this, and he goes, "Well, we just ordered all this old kit, so we're just going to stay with that." I go, you can't. I mean, you'd be better off to contact you. I go, just he'll help you out with his interviews. He'll help you out with all this type of stuff like he did us. But I was like, if you're not filtering this protein, filtering out the white blood cells, you're really doing a disservice, like you just mentioned. I didn't quite tell him that it's a procedure he's doing that he wouldn't do for your dog, but the advancements, and I think doctors need to know these things, to be able to stay on top of some of the latest and greatest. And that's what we call it. Hey, this is like PRP, but way more advanced. And we're excited to be able to do it.
Yeah, and if patients are listening here, like I said, just because someone told you have to have a joint replacement, that's not the case most of the times. Like you go to someone like Dr. Wendell who knows what they're doing, get evaluated. And if Dr. Wendell says, I'm not anti-surgery, if someone has to replace a joint or has a back surgery or something, I'll be the first one to tell you. But come to someone who specializes in that type of care and make sure you get a second opinion, because so many people don't get that second opinion and they make the mistake of having the unnecessary surgery. And I can't tell you how many patients, I'm sure you're the same way, that we're treated because of failed, knee replacement surgeries or back surgeries. And those are more complicated cases. I mean, once you go in there and you're surgical altering stuff, those situations there, I can't promise you I can heal you. But if you got the original gear in there, there's a good chance we can get you back to 100%.
Yeah, no aftermarket parts for sure. And I do want to.
It never works out.
Well, and I do want to encourage, if you are a chiropractor listening to this, this is something that you need to find a provider, and heck, even figure out ways that you can integrate. And that's what we did many years ago. A lot of this came down to a needle. And my state board says, look, you can draw some stuff out, but you can't put some stuff back in, even though it could be vitamins, it could be, working with their blood and things like that. So get over it. And figure out a way that you can actually do this for people in your own clinic and integrate like Buzz has done, and myself as well. So, Doc, I know your time is precious. You are super busy, and appreciate you jumping on here. Can you give us a breakdown of basically your website, where people can get a hold of you, whether it's doctors looking for like the A2M, procedures and kits and things like that, to NAD, to even the stem cells that you're doing such a great job with? Just give us a breakdown of that.
Yeah, so the PRP and A2M kits is a company called Regenerative Kits. So just do regenerativekits.com. And the umbilical cord extract product is comprehensivebiosciences.com. And then for the NAD, glutathione, and BPC 157 and Ionta patches, I got my shirt on today, pushpatch.com. So, or they can just reach out to you can just call me directly on my cell phone. I work 7 days a week. My cell phone number is 614-562-9110. So 614-562-9110. And I can kind of walk you through all the different options. Kind of like we did when we first met. I love, this is what I do. I do all day long, every single day. And these are all just different tools in your toolbox. Sometimes you need a wrench, sometimes you need a screwdriver, sometimes you need a hammer. So we can talk through those, but if you the regenerative medicine is the future because it's the only thing that works. the good news is there's no other options out there that are better or even close. So the future is bright, and we can help lots of people. And trust me, lots of people need it. That's for sure.
Big time. And I appreciate your commitment to doctors and indirectly the patients that they get to facilitate this healing process for people. So cheers to you. I appreciate you jumping on, and wish you a very, very relaxed, hopefully, holiday weekend with Thanksgiving coming up. Enjoy your family. And
Oh yeah,
I look forward to chatting with you more. Again, I appreciate you jumping on.
we got the big game too. We got Michigan, Ohio State, so we're gonna go watch that, I think.
Oh, that's right. That's right. I'm sure some of those guys have had some of these injections.
Yeah. Uh, yeah. Hey, well, thanks so much. I really appreciate you helping us spread the word. And like I said, definitely, you're definitely doing a huge service to your patients. It's you have to be brave a little bit. I mean, and all of us have been ridiculed a little bit, I think, by some of the traditional medical doctors who don't know what we're doing. But I'm sure your patients speak very highly of you. And like I said, if you have some type of condition out there, find a regenerative medicine provider, just like Dr. Wendell or myself, and get a second opinion, because this stuff really works.
Save the joints. Save the joints.
Yes. Awesome. Well, thank you so much. I really appreciate it.
Likewise, Doc, and we'll be in touch. And for everybody else, we'll talk to you next week.